Hi, I'm Dr. Italo Brown.
And I'm Dr. Cedric Rutland.
This is Barbershop Medicine. Oh.
It's close. Let me make a call.
This is what I'm talking about. COVID-19 has affected the way that we live in every way possible. See, this is the reason why I tell people they gotta wear masks. It's why healthcare providers have been working it.
I just got off the phone. He's down the street. He's outside.
Oh,
he's cutting outside.
All right, well, come on, man. Let's go.
Let's go. Come on. Yes, sir.
Right here, yeah.
Yeah, you got it,
man,
bro.
appreciate it.
I'm joining this convo, talking about how COVID is affecting the black community, and brown community, you feel me? So,
How did it affect you, like, off the rip?
It's weird, man. It's like, I lost my grandmother to COVID.
Sorry to hear that.
Oh, man, bro.
And it was like, as a man that likes to really fix things. I mean, we men like to fix, build, naturally, biology. I couldn't do nothing. I couldn't see her. I couldn't help. And I was like, man. So when the vaccine came out, I was like, I want to educate myself because I want this.
The vaccination, we feel, is necessary. Because if we don't get the vaccination, already knowing that there are healthcare disparities and equity problems, if we don't get the vaccination, it's actually gonna widen that gap. Because if less black people get the vaccination, that means more black people are gonna get sick.
I got like a myth debunker I need y'all to have. Cause like, on my way over here, the driver was talking about how he was through the swine flu and all these other viruses and his perspective on that. And he says back in the day, it used to take 10 years of research and study to get that for the people. And so acknowledging that we are better with technology and medicine, is it still that 10-year necessary to have a vaccine such as COVID for people?
So, my first thought is, time to figure this out is never wrong, but there is urgency. So that 10-year rule is literally what happened before we got to the vaccine now. So you had years and years and years of research that was being conducted on this mRNA technology.
Right.
And it just so happened that we had the opportunity, unfortunate opportunity, to put it in practice.
So the mRNA technology came to fruition in like 1990. What Italo was talking about, and it addresses Masego's question, is when you're thinking about research. Here's the thing about vaccines. To be able to generate or manufacture a vaccine, you have to know what the virus looks like. In other words, you have to know the construction of the virus. You have to know what coronavirus is, right? We know what it is because of the SARS-CoV-1 epidemic in China in 2003. So when you look at it initially, you're like, oh man, we got this vaccine in a year. That's not true.
It's not at all.
We knew what the spike protein looked like. It looked 90% like it looks like in SARS-CoV-1, so we already had the sequence.
I felt like it happened too fast with the solution.
Yeah.
And so that's what made me doubt it. So yeah, after y'all's education, I'll definitely tell it to more people as well because y'all know what y'all talking about.
Do you play?